thank you very much again for the organizers on the kind invite. And I am really happy to be here among esteemed speakers. I have learned a lot from our colleagues, and I hope that a bit of what I'm going to present will have some input into the whole dynamics as well. My background is actually a medical doctor and in public health, but I am sort of thrown into the midst because they gave some grants to look at vaping among our adolescents. That was many years ago, and of course that started the ball rolling. And the more that we found out that the more, there are countries that's using so-called reduced risk products in their regulations, and that sort of put me in the game as well. I'm very happy to be here. This is my first time in Athens. I see very wonderful people, very kind people as well. So smoking in a way is a global pandemic. We know this already, and the projected prevalence of consuming tobacco products in sort of Asian countries, looking at Malaysia and all, these are some of the very high prevalence of smokers, especially among the males more than 15 years old. And it causes, of course, a great deal of mortality and also morbidity, specifically for smoking directly and also secondhand smoking. The new innovations sort of created a panic status in Asia as well. Most of these are poorly regulated or very, early regulation stages. And of course, we know that the burden of smokers as well are very high in our low middle income countries, mostly in the Western Pacific regions, and also in Southeast Asia, where I'm from. By WHO, Malaysia would be in the WEPA region as well. And our youth smoking initiation, this is from WHO, shows that, a lot of our youngsters start smoking, cigarette smoking is very young, 10, 12, because they are exposed to their families as well. So when the parents smoke, most of these kids will actually take up from the family as well, and they have friends that's doing this. So this is a normal culture in many countries in Asia. And where I come from, which is the Southeast Asian countries, so I'm going to talk a bit some of the countries that's involved, because they will play a role in how Malaysia or other countries actually adopt reduced risk so-called policies as well in our countries. And we know that most of the smokers, which are mainly males, of course we have a smaller number of females as well, and the number of people who are using ends, and this is where the sort of the panic starts to come in. Most of the argument is against youth usage, as in many countries as well, and mostly in these developing countries. And we see the range of people taking up ends are increasing year by year. The prevalence was, from 3 to 5. Now it's about 16 to in other countries, including Malaysia. So we are also experiencing this. Heated tobacco products, snus, are not really used as much in our countries. One of the reasons is because the market is actually very much costlier. Not many people are able to use heated tobacco products. In Malaysia, one of the producers would be PMI, IQOS. Again, a very strategic market, and this is mostly a market to the high income and also middle income. The low income will not be able to use this. So there are main players in Asian, and the so-called transnational tobacco companies from this WHO website would be, BAT, PMI, and so forth, Japan, JTI, and so forth and so forth. They have been seen as tobacco big industries who have sort of trying to push new agenda into the market, which is the so-called the ends, the heated tobacco products and so forth. So this is one of the reasons why rejection is very high in our countries. So the market value has gone, from strength to strength. It has increased, and these are some of the ways that they have put it, by countries and so forth, and which sort of tobacco companies sort of control the market there. And again, some of the earlier reports shows the gateway effect, into smoking, and in the end it will lead to drugs. So this is the assumption, and of course in some of the reference that they have used, which was probably pertinent at that point in time, was quite high in some of the meta-analysis. So this was used as a Bible in some of the countries, and we keep saying that this is a gateway effect, this is a gateway effect, and we have a lot of resistance trying to move that trend. I think most countries are also facing these problems. More importantly in our countries, because the evidence is very lacking. There's not enough data. Most of the data are either subliminal, and it's not up to par with international countries. So when we reference to other countries like OECD countries. The policymakers will say that this is from other countries, we should do our own. And when we say that we are going to do our own, and usually there's no budget for that. So in the end, it becomes very, very small segregated data from local small studies. There are a change in regulation in Southeast Asia. You know, some of the countries are actually trying to envelop so-called this wave of reduced risk product or non-combustible products in the market. It is seen regularly as a big tobacco lure. You know, the big tobacco are actually fishing us. You know, we are not supposed to do that, and so forth. And we have to understand that most of these countries are very much dependent on WHO for certain budgets. So in a way, we are sort of tied or married to them. And I'll give some testament to that as well. And but 10 years going on, not 100% of us are actually anti-vape. Some have actually embraced the so-called phenomenon, and it has transformed into bizarre patterns of people either legalizing, semi-legalizing, or complete ban, and so forth. So some background would be, a very important aspect is that we are sort of a middle income, a group of countries, and by 2023, the biggest GDP in our Asian countries would be Indonesia, followed by Thailand, Philippines, and so forth. Malaysia is just comparable to Singapore. This is in 2023, but of course, the highest would be, looking at WebPro, would be China, who just basically is a giant above all of us. So I'll just give an example of how Malaysia is facing this phenomenon as well. So Malaysia is situated, for those who have not been to Southeast Asia, we are just below Thailand and above Singapore. That will put into context. So we have about 33 million population, different ethnicity, different cultures. The way that we speak are also different. Smoking is generally very high. Prevalence is very high. There's no significant changes, for my opinion, for the past decades. It sort of fluctuates between 24, 21, and so forth. But the prevalence among male who smokes about more than 15 years old is nearly 45%. So one of our latest surveys that shows the adolescents prevalence sort of drop, and of course this could be one of the reasons, could be because of the introduction of reduced risk products as well into the market. Of course, there could be other variables as well. And Malaysian teens are using e-cigarettes and also vaping. It has increased to about 15% in 2022. We don't really know what's the prevalence of snus. It is sold, but it's a very small market. We don't really have an actual data on that. Same thing with HTPs. We do predict that it's going to grow with the lowering of costs in HTP production. We foresee that there's going to be a bigger market for HTP as well in our region. Malaysia is trying to emulate New Zealand, and we see New Zealand as the gold standard, GEG, Endgame, and so forth. I'll talk about that as well. But our prohibitionist approach, which a bit different than what New Zealand has, which only so-called banned tobacco. And Malaysia is trying to ban everything, which includes tobacco and vape in the year 2005. And this cohort of 18 years old and above, that means if they are born in 2007, they're 18 years old and above, they are not able to purchase both tobacco and also vape. This is the plan. A lot of us are very worried about that. A lot of CSOs. At the moment, I'm the president of the Malaysian Society for Harm Reduction. A few other NGOs are also coming up, consumer groups and so forth. We have mentioned to the government that this is very scary. If you ban both, the people do not have options, and this would be mostly the low-income people in our population. So they have sort of tabled the first time. They're going to table it again in October. We don't really know the outcome. And the confounding effect is that we have a high burden of illegal so-called contraband cigarettes and also query vape in Malaysia as well. This is one of the statistics that shows, it's about 60%. That means that for every 2 people who smokes, 1 of them would be actually using illegal cigarettes. So this is in Malaysia comparative with other countries. Just trying to show that we have a very high burden of smoking that starts very early, and most of the guidelines at the moment is only looking at NRT as the cessation treatment. We don't have other modalities that is acceptable by so-called legal framework, and they obtain cigarettes sometimes from the family and sometimes from schools, because this is considered something which is norm at that point in time. And this is what I mentioned just now. The prevalence is sort of, it just hovers there. It did not really go down as what we expected. And of course, Malaysia is as well signatory to the WHO from 2005. So we have sort of a solid strategies in place, but we have not been able to achieve what we have planned. So this is a common statement as well. This is not something which is predicted by me. It is all in the websites where a lot of Asian countries are actually hub for illicit cigarettes, Malaysia included as well. So even though that we have increased the tax, and increasing the tax is sort of deter people from buying so-called legal, and they buy illegal, which is almost 1/3 of the price. So it's very cheap and it's easily accessible. So this is one of the reasons why smoking is actually very high. It's easily accessible, and the issue is that we are not able to control it. Malaysia is very porous, and of course, it needs a lot of policing and government budget to do this. Limited studies in Malaysia as well. Smoking is mainly consumed by the low income and the low socioeconomic groups. It's more in the rural as well. Vape is mainly used by the males, females less. But illegal vapes are coming in, mostly are coming from China. So the vape market are actually increased, it's very high. Some of them actually produce and sell it to other countries, to UK examples. And the HTPs are mainly used by the economically more apt population. Most of them would use flavoring, such as fruity flavors and so on. But a sudden turn of event when in April 2023, a decision was made to collect, or to consumption tax was actually put on to collect tax from reduced risk products such as vaping, which is very low, about 40 cents per mil. And the Malaysian government at that point in time exempted the nicotine liquids and gel, including NRT, from the Poison Act 1950. Previously, all of this was under the Poison Act, so you have to be prescribed. But a sudden turn of event, they sort of legalize it, and that makes it open market for all the e-cigarettes. Unfortunately, is that there are also illegal cigarettes on the market. So this is where the problem starts, and what happens is that there's a few cases which was deemed as e-vali that happened in Malaysia. We don't really know. Of course, there's no autopsy was done, and this was a scare message to the population. So most actually would say that even healthcare professional would say that e-cigarettes and vape are actually more dangerous compared with conventional tobacco. And this is where the worry starts. And most of us in the so-called area or in this field would actually recommend the government to sort of regulate vaping again because of this issue. A few states actually have already come forward and say that this is vaping, and it's already like haram, meaning that you're not supposed to take it, coming from so-called mainly majority Muslim countries. But it does no good. People actually use this as well, so they don't really care. So what our previous health minister would actually want to promote is the Generation Endgame coming into context with New Zealand. So will come into effect proposed to come into effect in 2025, which says that whoever is born in 2017, they turn 18, they're not supposed to buy not only tobacco but also vape. So in a way, the option is very, very limited. They only have NRT to turn to. And anyone who is born after that and who actually use that will face a fine. There's going to be some sort of criminal charges. They say that they're not going to do that, but then they say that they're going to do that. So we're not really sure actually which way they're going to go. So who is going to pay for that? Because this is already consumed by the low-income population, and who is going to pay for this money or these charges? Is it the boy, the family? And what's the impact of that? Because once you have a criminal charge, it's very difficult for you to enter universities. You will have that stigma attached to you. So and we keep mentioning that even though with the GEG, the youngsters can actually purchase tobacco or vape from the elder population, because you have these two cohorts. The young ones are not supposed to buy or cannot buy, and the elder can still use this to the end, so they can still use this and they can just sell it. So there was some reports, and of course this was a big win for the country. A lot of people actually supported GEG, even among the smokers, the vapers, and also people who don't smoke. They sort of support this idea. So this is the GEG. So one of the reports by other think tank shows that, if you actually impose the GEG, you're going to see a huge rise in black market as in other countries, and you're going to have a loss of so much money because of that. If you're able to convert this would be, if you do a cost benefit analysis, your benefit would be more. So other surveys would show that even the population says that you should not be punishing Malaysian vapers with this regulation and so forth. A lot of percentages, people will say that they are going to go into black market, they will go back into cigarettes, and these are already mentioned earlier on. But I think because of what the government would see as the benefit, they will still want to propose the EGG to be moved forward. So I'll just touch a bit on other countries and how they sort of affect in this region. So sort of Brunei, which is just nearby to our East Malaysia. So they are also signatories to WHO, FCTC, and the smoking prevalence was actually slightly high, increased since 2000, was about 16%, and increased to 70% projected in 2025. There's a lot of recent anti-smoking efforts, provision of NRT clinics, smoking cessation clinics, and counselings. And you can just buy NRT, which is legal in the pharmacies and so on. And e-cigarette is also deemed as a tobacco imitation product. So you're not supposed to actually use e-cigarettes as well in the public facilities, public transport, and so on. And you get a fine, of course, you get a fine if you actually use e-cigarettes as well. So Brunei is very near to us. They are sort of richer than Malaysia as well. So it is prohibited by the tobacco order since 2005. It's illegal to purchase, but you can use the nicotine liquid preparation. So this is where the perplex actually comes in. Above 7.5 are considered as poisons. So below than that, you can actually use this. The Poison Act stipulates, you need a license for that, and you need a license before you can actually import this and so on. You get a fine if you actually smoke and also use e-cigarettes in public spaces. And also, unfortunately as well for them, that you can actually see a lot of e-cigarettes, so-called illegal e-cigarettes being sold, even though this is considered illegal, meaning that the black market is also quite rampant there, and people are using that, and people need that as well as an alternative to smoking. So in Singapore, which is the bottom of, geographically they are south of West Malaysia. So Singapore is a very advanced country. It's a very developed country. It's very high GDP, high HDI. HDI is also very high. They have a very good tobacco-free generation initiative, which runs many years ago. Their population is also quite small, relatively with Malaysia. This is about 5 million. They have a good sort of healthcare systems through their Medicare and so forth. The smoking prevalence has sort of reduced, and we foresee that they are going to achieve, the vision for WHO, the earliest in our region. Female smoking rate is about 5%, and the minimum legal age, what happened in Singapore is that they have raised it to 21 years old. So you cannot just buy a cigarette, even though you're sort of 18, you have to be 21 now. They have raised it from 20 to 21. Underage smoking, there's a fine for that. You can't even litter your cigarette butts and so on. All tobacco products are now sold in plain packaging, so very strong in that. And eligible population would be offered NRT free in public institutions. And they are also stripping the nicotine from cigarettes to the point which they deem as not addictive. It's not as low as what Prof. Marewa said yesterday. This level is around 0.4 milligram per gram, which is very much reduced from the normal so-called concentration. Vaping is considered illegal, totally illegal, but what happens is that most of them would bring in from Malaysia, which is, because we have, Singapore is just the border, so you just cross the border and they just bring it in the trunk, in the car and things like that, and they sell it illegally in Singapore. If you do this at home, of course, nobody will catch you, but you can't do it, of course, up front. There's going to be a lot of policing. And of course, there's going to be some charges up to $2,000 US per offense. And of course, you have to bring in, you want to bring it in, you have to pay some tax, your GST and so forth. And the health service, so-called authority, which is sort of Ministry of Health in Singapore, did say there's a rise in the vaping trend. So what happens is that in Singapore as well, there could be some changes in policies in the future. We don't really know. There could be a need for harm reduction. We are not sure. At the moment, it is totally a solid ban in Singapore. But illicit market is also rising in Singapore. About 4% actually use alternative products like vape, and there's an increase year by year. But even the Ministry of Education says, some of the reports says that they have managed to sort of catch students using illegal e-cigarettes when they're at school and so forth. And this is one of their so-called rush on this. So Indonesia, which is very near to us, this is one of the reasons why we have a huge percentage of people smoking as well, because it's very near, very porous. We take a lot of cigarettes from Indonesia as well. This includes the special cigarettes without the filters, what they call as kretek. Some of them are actually, they can actually plant on their own and use them for themselves. And Indonesia has one of the highest burden of smokers in our region. About 65% of the adults, men, actually smoke there. And of course, the cost is actually very high to treat this. Since 2015, they banned tobacco advertising. And also, what is very interesting is that their National Commission for Tobacco deem tobacco and e-cigarette as equally bad. So there's no reduced risk view on vaping and also other methods. They are mentioned as all equally bad. And there's two groups basically, same thing with Malaysia. A lot of them are pushing for vaping as well, but there's a huge group which comes from the government and so forth, which actually would want to deter that as well. There's no specific regulations on e-cigarettes, even though there is an excise tax. So what happens is that a lot of people are actually experimenting and using vape in abundance. And of course, they have a regulation prohibition to sell cigarettes to youngsters, but it is poorly executed. And some of the literature would say that, even the vape stores are actually very near to schools and so forth and are being sold openly. So the burden of this tobacco-related disease in Indonesia, we mentioned, is very high. They are not signatories to the FCTC. So they are, from some of the literatures would say that they are the tobacco industry's playground. And regulations on marketing and promotion are not yet adopted. So there's a lot of people experimenting with e-cigarettes. Most of these are either from vape shops and also online. And the market actually risen higher by higher each year. Thailand is also a very interesting country because it's just on top of us, and they are also signatories to WHO. They are seen as a global leader in our region in tobacco control as well. The Thailand tobacco monopoly basically controlled the country's tobacco industry. They want to protect the local tobacco dealers and also sellers in their country since the 1940s. Huge burden of people actually die because of tobacco smoking. And they are also one of the countries that actually has standardized tobacco packaging, so quite advanced. And they completely ban possessing anything related with vaping products, meaning that you can't use that in effect in Thailand. Even though snus and RT is allowed, it's legal. And so if you go to Thailand, make sure that you do not bring in any vape products as well. A huge black market has established, and the present laws that you will be fined if they catch you using e-cigarettes there and vaping. It has been banned since 2014, and anybody who is caught vaping and so forth will have a fine. You can actually be thrown to jail as well. And these estimates of values of the illegal cigarettes, illegal vape are also increasing in their country. But there is some hope because some of the so-called NGOs and CSOs are trying to promote or trying to get the government to allow some form of harm reduction products to be sold in the market. And so this would include NGOs like ECST, CAPRA, trying to promote harm reduction to be sold in their countries as well with some input from the government. So Philippines, I'm going towards the end. Philippines is our friends as well, very near to Malaysia. They are signatory to WHO as well. Yesterday's session with Dr. Faris, Dr. Lorenzo Mata is one of the persons who actually, one of the NGOs that actually promotes harm reduction. And a huge burden of Filipinos are actually smokers as well. They smoke very high percentage, and about 16 million of them are smokers. Huge amount of smoking-related death annually as well. But they are at the moment, 37.1% of underage smokers are being able to purchase tobacco or e-cigarettes freely. So this is a problem as well in many of the countries as well. The smoking quit rate is actually very low. CAPRA, one of the civil society that I mentioned just now, trying to get the government to reject these prohibitionist measures and trying to get, and so with Dr. Lorenzo. And I think they have succeeded with the tobacco bill, sort of the vape bill that has been declared in Philippines, meaning that they are able to sort of legalize e-cigarettes usage and also selling of e-cigarettes there. And this is basically one of the first in Asian lower and middle income countries. So when other countries look at Philippines, we are also looking at some of the success, but also if there are going to be failures, this is some of the emulation that comes into play. They allow up to 65 milligram per mil. More than that is banned. You have a legal age, and there's going to be restriction as well. So you're not supposed to sell to minors, and you're not supposed to use it with THC or cannabis oil and things like that. Whether they are able to adhere to that is another issue. So last is actually China. Why China is included, even though they are not an Asian country, they are sort of one of the REPO regions, but a lot of what China is doing will actually have a significant impact on other countries there, because we are in the same regions, they are the main suppliers and so forth. So they are the largest producers and consumers of tobacco in the world. They signed the WHO treaty in 2003, coming into effect 2006. More than about 300 million smokers. So huge number of deaths as well. They have a healthy strategy as well, 2030. And the prevalence, of course, is more of the males compared with the females. But they have, from 2019 and 2021, what is interesting is that they have a state or so-called STMA, which is State or National Tobacco Monopoly Administration. And coming into effect in May 2022, the law bans the sale of any flavored e-cigarettes other than tobacco. And they also prohibits the online selling, mass advertisement, exhibition, and so forth. So what happens is that but they do not actually condone. They condone the selling of inside their countries, but they actually allow exports. So meaning that they are exporting and also supplying e-cigarettes and also tobacco to other countries as well in the region. So this ban on smoking actually covers a lot of places as in other countries. Their limit is actually very low, only 20 mg per mil comparatively with Philippines and so forth. And the law prohibits the sale of e-cigarettes to minors as well. So they are trying to protect that, and they have already put up their consumption tax, which is very recent in 2022, November. You cannot mix your e-liquid on your own. You can't have e-cigarette sales near the education facilities and so forth. And but they are still producing a lot of that e-cigarettes throughout the whole world, especially in Asian regions. In example, the Alpha Bar and so on. So they must be registered with the local authorities, and they are even introducing electronic so-called transaction and platform for that. So in conclusion, we see that harm reduction is being taken up differently by different countries. Of course, it depends on how much budget that you have, your background, the population size, what's the prevalence of people who smokes, and also the role of WHO FCTC's involvement in each countries. And most of these, for the ease of implementation, will just take a prohibitionist approach. You just ban everything, so that would be the easiest. But the impact on the smoking rates also differ. I don't see any data at the moment to see that how's the role of e-cigarettes trying to reduce the smoking rates and whether that's successful. Maybe it's too early to see this, and we probably will see this in a few years coming forward. So most of these LMIC, we are involved with this illegal trade. So that plays a pivotal role in tobacco control. Of course, it depends on the budget and how much we are able to invest, because different states will have different priority areas and so forth. There's going to be many obstacles, and most of us would actually refer to OECD countries like UK, New Zealand, Australia, Sweden, Switzerland, and so on and so forth. So we don't really, have a proper so-called guide, and we're taking samples from other countries as well, here and there, and hopefully, harm reduction will be taken up by Asian region as strongly as other countries as well. Thank you.